We're close to turning the calendar, and the picture for 2026 is coming into focus. Enforcement is active, policy is tightening, the threat landscape keeps expanding, and one theme cuts across all of it. Do your security risk analysis and let it guide your real work. You can see that theme in recent enforcement from the Office for Civil Rights at the Department of Health and Human Services. Over the last year, several settlements followed the same pattern. There was an incident, often ransomware, and when investigators looked under the hood, they found a missing or an outdated security risk analysis, or SRA. One case involved a HIPAA business associate, not a provider. The penalty was significant, and it came with a multi-year corrective action plan. Now that part matters. It's not just hospitals and health plans. If you handle patient data as a vendor, then this expectation applies to you too. Policy points the same direction. The HIPAA Security Rule is the standard for protecting electronic protected health information. HHS has floated updates that, if finalized, would make some expectations more explicit. More rigorous risk assessments, stronger technical safeguards, and clearer expectations about incident response and backups. It's a loud message to evaluate risk regularly, fix what you find, and keep proof of what you've done. Hospitals are hearing this in another way through the Centers for Medicare and Medicaid Services. In the fiscal year 2026 hospital payment rule, CMS pushes beyond "we did an SRA once," right? Hospitals are asked to attest to ongoing risk management under the Promoting Interoperability program. And that is a shift in posture. It says the SRA is the starting line, not the finish. And then there's the broader security reality. Ransomware hasn't slowed down, it has adapted. Attackers now go after mixed environments, cloud identities, and virtual infrastructure. Everyday tools, email, collaboration suites, mobile devices create more places for data to land. Add in AI-assisted content and code, and you've got faster phishing, more convincing lures, and new ways for data to move. None of that means that compliance is impossible. It means that your SRA has to reflect how you actually work today, not how your environment may have looked 2 or 3 years ago. So what does strong compliance look like as we head into 2026? It looks practical. It looks like an SRA that maps where ePHI lives, who can touch it, and how it's protected. It looks like a short list of real risks, each tied to an owner and a due date. And it looks like steady, visible progress, not a binder that only gets opened in December. Here's how to get there without making it overwhelming. Start by scoping your SRA correctly. Don't stop at your electronic health record. Include file shares and cloud storage, imaging systems, email and messaging, remote access, laptops, phones, and any partner platforms where ePHI flows. For each, answer a few simple questions in plain language. How does the data get in? Where does it rest? Who has access, and how is that access controlled? Is the activity logged, and does anyone review those logs? Where are the backups, and when did you last test a restore? Next, write down the top risks in a way that your team can act on. Keep it specific. Privileged accounts lack multi-factor authentication, or audit logs are collected but not reviewed. Maybe backups are complete but restores aren't tested, etc., etc. You know your own environment, so pick the risks that matter most and assign an owner for each one. Give each item a first action that can be done in the next couple of weeks. The goal is momentum, not perfection. Then create a simple rhythm. Put a 30-minute review on the calendar every month. Look at what moved, what stalled, and what needs help. Save evidence along the way. This might look like screenshots, change tickets, restore reports, access review sign-offs. That running record is what turns your plan into proof. Fold in your vendors. If a partner stores, transmits, or processes ePHI, then they belong in your analysis. Make sure that you have a current business associate agreement. Understand how their access works. Ask how they log activity and how quickly they can notify you if something goes wrong. Document what you verified. You don't need to be adversarial, you do need to be specific. The chain is only as strong as the weakest link. Keep working the basics that change risk the fastest. That's turning on multi-factor authentication wherever you can, remote access, email, VPN, admin consoles, all of those. Do access reviews on your most sensitive systems and remove what is stale. Test a backup restore on a schedule and keep the evidence. Make sure key systems are logging and that someone's actually looking at those logs. And give your workforce short, focused refreshers that match their roles. Front desk, clinical staff, and IT need different examples, but everyone should know how to report a problem quickly. Here's a quick note on AI because it's not going away. AI doesn't change HIPAA's requirements, but it changes the routes that data can take. If your organization is experimenting with AI tools, treat them like any other system in scope. Where does ePHI enter? Where could it end up? Who can access it? And how do you limit that? If a tool isn't designed for PHI, don't put PHI into it. If it is, make sure that you have the right agreements, controls, and logging in place. Those are SRA questions, not separate projects. When the analysis is handled well, teams walk away with a few tangible things: a clear map of where ePHI actually lives, a short list of the top risks in plain language, named owners with realistic timelines, and an evidence trail that shows what changed and when. That's what turns the SRA from paperwork into something that you can point to when questions come up from leadership, insurers, or regulators. Current also has a practical meaning. The analysis should be refreshed when the environment shifts. A new vendor or integration, a move to a different cloud service, a new clinic location, an AI tool is introduced into a workflow, a major update to your EHR, or a change in privileged access. You don't start from scratch every time. You update scope, risks, and owners so that the document keeps matching reality. The same goes for common blind spots. You might see vendor remote access left always on, shared or service accounts with no multi-factor authentication, audit logs collected but never reviewed, backups that pass but restores that were never proven, or access that lingers after offboarding. A good SRA services those quickly and ties each one to a specific fix. Finally, think about evidence. If someone asked tomorrow, how could you open a folder and show training records, access review sign-offs, a recent backup restore report, your current BAAs, and notes from risk meetings? You don't need a new committee to make that happen. You need a steady cadence and a single place where your proof lives. That's the compliance checklist for 2026 in practice, not a wall of requirements, just a steady way to show that you know where your data is, you understand your risks, and you're doing the work. Let's circle back to those signals we started with and let's tie them together. Enforcement is active. When OCR publishes a settlement, the write-up rarely ends with, "There was ransomware." It usually lands on missing fundamentals, no thorough SRA, no timely notification, gaps in access controls or logging. The message is consistent. The basics are not optional. Policy is tightening. Security expectations are being clarified, and in some places, those expectations are being raised. CMS is asking hospitals to pair analysis with ongoing risk management. That's the same posture that we expect to see echoed elsewhere. Show the work and not just the plan. Threats keep evolving. Attackers adapt. New tools introduce new pathways. The best response isn't to chase every headline, it's to keep your footing. Understand your environment, close the obvious gaps, and make progress that you can demonstrate. That's why we keep coming back to the SRA. It isn't a once-a-year ritual. It is a way to align your security work with how your organization actually operates, and it's the way that you prove it. If your organization still needs to get its security risk analysis for 2025 on the calendar, we can help. At Medcurity, we make the SRA clear, actionable, and audit-ready, and we help you keep it current as your systems and your staff change. If you're ready to start, reach out and we will get you moving. Thanks for listening to this week's episode. Let's head into 2026 prepared with the basics handled and the evidence to back it up.